Hello and welcome to the Quest for the Good Life with Dr. Mike Strauss. I am Ivo Ivanov, your co-host, and today we have a special episode, and the information density will be a little higher today because we are aiming to provide you with very valuable information today, and it has to do with our seniors and the Senior Neighborhood Network. This is a topic that's very close to me because my parents are aging and I'm currently looking for options for care. And I know that this is close to Dr. Strauss's heart as well. And we have very exciting developments that have really been in progress for the last couple of decades. And I think the time is now to address those problems. And really, I would like to start this by talking about in-home care.
Yeah.
Is it viable? Is it possible? And if not, why?
Yeah, I think as you know, Eva, I'm a behavioral analyst, so I always like to look at why things aren't delivered the way we want them to be delivered.
Yeah.
And I also like to look at other models that actually can deliver support and services the way we want and see how we can get all the advantages of the models that work, but none of the disadvantages. And that's kind of, the hope for sort of the holy grail of services as we go on our quest for the good life. I got to tell you though, the best thing for me to start off with is just to tell the story of my parents who are no longer with us. But when they were alive, in the last few years of their life, between the two of them, they could do about 90% of the care and support they needed. What one didn't have, the other had. And, as a couple together, they could help each other and really take care of things. And, that's pretty true for a lot of aging couples. Say between the two of them, they can do a lot. The problem was they probably couldn't do about 10% of the things. There was things they couldn't do and needs they had they couldn't meet between each other. Here's the problem. Those 10% were not things that they could schedule. They were about needs they had that were random or unpredictable. And the bottom line is they had only 10%. They were 90% independent and 10% they needed help. But the help they needed wasn't predictable. It could happen at any time. And because that 10% was not something that could be scheduled, they had to trade 90% independence for 100% care in a care facility like assisted living. And I'm telling you, that's a story of that I hear everywhere, that, my father can do most things okay, but there's a few things he can't do, but those things are intermittent and unpredictable, and I just don't think he can do it for himself, or they can't do it together anymore, or it's become too much for mom, or it's become too much for dad, to do, or they just take risks. For example, Evo, that they can't take anymore just because of a few things that they have to do, but they have no choice but to take risk. And let me say it even differently. They have no choice because they can't afford assisted living because it's too expensive. I mean, Evo, assisted living is, $8,000 to $10,000 in most places now. It's incredibly expensive. And, people, seniors in a fixed income, many of them have enough to live independently. They have enough. They may make $75,000 or more a year, and that sounds like a lot of money to live independently. But the problem is you could live independently, but you can't afford assisted living on $75,000 a year. You can't. You become almost completely dependent upon Medicaid or public funding when you don't make enough money. And the worst yet is, let's say you have one person of the couple that is able to live on their own, the other isn't, and it's just too much to do. And so you got one living in assisted living, the other living in a home. So you have now two homes and two lives that you have to support. So it's not just the cost of assisted living, it's the other cost too. It is completely unaffordable.
Yeah.
And the biggest issue is in-home care is all designed around having the staff person able to work with a individual in a home. And that sounds simple, but it really isn't because staffing is so unpredictable. I mean, I always said if we did Uber like we do in home care, we would hire a driver for everybody that needs a ride.
That's right.
And of course that's not practical.
Yeah.
And so since most needs are intermittent and unpredictable, you have to, for in-home care to work, you have to hire somebody who is going to be stable, that's willing to work at any hour, which they're not, and they're also willing to like sit there and wait for a need, and you're willing to pay for somebody to sit there and wait for a need. Now you look at that and you compare that to assisted living and how it's different. Nobody wants to go to assisted living, but in reality it does work in many ways, and that
Kind of.
it's not what you want,
Yeah.
but you have a core group of staff supporting a variety of people. That core group of staff is available for intermittent needs, and they have a less people than staff than they have people they're serving. So they're able to be. It's not one-to-one care. It's one-to-many care, and
Hmm.
they're able to ebb and flow that around needs, and they're able to staff it with full-time people working shifts, predictable schedules, so that care can be delivered. And if somebody doesn't show up that day, they got somebody else to show up. There's going to be somebody else. And in-home care doesn't work like that. If somebody doesn't show up, you got nothing, and you got a gap. And so if somebody quits, you got to hire somebody. Do you know today, I have worked in state after state after state, and I can tell you this. If you look at the authorized hours needed for in-home care per person, most states are averaging no more than being able to deliver about 50% of those hours. Meaning, they're not, if you need 100% of the hours for help, and they're only delivering half of them because of the ineffectiveness and the instability of one-to-one in-home care, then you can realize that's a model that nobody can afford, that's not sustainable. And if you have a kind of important needs, you can't afford half of the time somebody not to be there. And you can't afford somebody to be there waiting for that need. So you can't afford either of those. So you end up going to assisted living that you don't want to do, but you do
Hmm.
it anyway because that's the only way you can get care. And that's
Yeah.
it. So your choices up till now have been in-home care that's not effective, or assisted living care that's effective, but not. It's like going to a store for care.
Mm.
If I used to go to a store for movies, Blockbuster. Remember, you go to a store and you
Yeah.
pick out movies. And
Yeah.
then Netflix came along, and then
Yeah.
Netflix basically made things on demand so you could get it anywhere, anytime you wanted it. And
Yeah.
Blockbuster's business plan no longer worked. Well, it's time for Netflix with in-home care. It's time to be able to get a different version of care. So the problem is that in-home care doesn't work the way it traditionally does, and it can never work because of how they do it. But facility care, like assisted living, does work, but nobody wants it. So is there a way to get all the advantages of facility-based care with none of the undesirable parts and just general support? Is there a way to get that, but not in the traditional way, in a way that works better? More like the characteristics of facility-based care, but not in a facility. Does that make sense?
Yeah. Is there a Netflix? Does that exist?
Yeah, yeah. The traditional method isn't affordable, isn't effective, but we've created. We're looking at a solution that has certain characteristics. Before I tell you what it is. I wanted to go through the characteristics. I wanted it to be affordable. I want you to only pay for the services that you actually need and use for
Yes.
only as long as you use them. I mean, the most important thing is I want you to get care in your home, and I wanted you to be able to get it for only what you need and for as long as you need. And I wanted you to be able to you to decide that as a customer, decide the support and care and that you need, or just the general help that you need. It may not be anything really fancy. It just may be small things that are too risky for you to do, right? It's not
Yes.
even care. It's things around the house and other kinds of things that you need help, and you don't want to plan for it. You want it like now. And so I wanted something that could do that more organically. I wanted it to be delivered by full-time staff. In-home
Mhm.
care is almost half of the care of in-home care right now is delivered by part-time moonlighting staff. That's not a way to get care. You will
No.
need full-time people. So I wanted that. I wanted you to be able to leverage your natural resources that you could before you actually use paid resources. What I mean by that, if a family member is willing to help on this, that, or something else, and they were available, fine. You should use the family member if you can and if they're willing to do that, or even volunteers, neighbors that want to help neighbors, all those sort of things, or use organic supports. But then when you don't have them, I wanted to bump up to something that you can always depend on as a primary support or as backup. So you always have, something that you can count on, even though you may ask other people to do it first, if that makes sense. Use your natural supports. And when you don't have them, then you can use some paid, but it's only that little bit that you need to make it work. And we must leverage, advanced technologies. I mentioned Netflix. You know why
Yes.
Netflix worked? It was because it was on a platform of technology, and technology has changed everything. And so, technology makes things possible. But the problem with technology, Evo, is it's complicated and it isn't adapted for seniors. And of course, we'll talk about that in the solution. And then we need to learn the lessons of long life. I want to really emphasize this. The truth is, there's probably 5 or 6 practices that you have to do and do regularly that are really simple, small things that you have to do to extend your life. It's taking out some of the risk. It's doing some good, preventative activities. It's making sure that, I'm not going to go into all of them because that's for another day, but it's like being hydrated and making sure that you do your steps and you're active and that you have purpose and that you're engaged in things and that you work on your mind. There's some things that you have to do that we all know. Research has shown us that we have to do that aren't complicated, but we kind of need a coach to help us do that. And we need to make sure that we do the things like right now, I got watch the ICAP biometrics. I know all my health factors. It's not a problem anymore. But the problem really is, Evo, that seniors don't do those things.
Yeah.
If I could digress for just a second, I want to tell you, my son's a financial planner, and he works with for in retirement area for planning for people's retirement. It's the number one thing you have financial planning for is to retire.
Yeah.
Well, seniors are really good about thinking about with a planner, a coach. They're able to kind of look at all the little things that they're supposed to do to shave off, tax dollars and to maximize returns and to keep your earnings safe. They do all this planning, all this work to make sure they have these resources and they engage in financial saving practices. They do all the things they need to do to take care of all the risks of retirement except the biggest one. And the one financial risk that is the largest one of all that they do nothing to avert is their own well-being and health. 5 or 6 simple practices that they could do to extend their life for 5 years or to
Yeah.
keep them out of assisted living. The reality is financial planning plans for you being retired. They even plan for you to be in assisted living, but they don't plan for you to not be in assisted living.
Yeah.
And I can't believe that. The largest expense that a senior can plan to avoid is in facility care. It's also the one that nobody wants. So why won't they go upstream when they're capable? A senior like me, why won't they go engage in some of the practices upstream to avoid that?
Mm.
Why do they just take the risks and then the fall happens, or they take the risk and a health factor happens, or they take the risk and they become isolated, they engage in things they shouldn't do, and all of us, or don't engage in things they should do, they delay them, and then all of a sudden the big thing happens, and they thought, oh, I didn't know that would happen. But the reality is it's inevitable that
Yeah.
it's going to happen. It will happen. It
Yeah.
will happen to every one of us. The question is, when is it going to happen? And can we move it down the road a little bit, a long ways, or forever? And
Yeah.
if seniors engage in all these other good practices to save money, why won't they engage in the certain simple, straightforward practices to keep from losing not only the money, but their life, their way of life? I
Yeah.
believe that it's because they haven't got a coach. I believe that they're not, they need more education on it. I believe they need more support on it. And that was a driving force behind the creation of what I'm about ready to talk about.
So, does that solution exist anywhere?
Yeah,
All
yeah,
those
we have the solution, and that's why I'm so
what?
excited today, to talk about this solution. Started in 2010. We created what we call now the Neighborhood Network, and
Yes.
fundamentally, the bottom line about our approach was we wanted to create all the advantages of facility-based care, but with and support. I don't care if
Yeah.
you need water or you need food or you need somebody to change a light bulb.
Mm.
They do all of that in assisted living, right? Not only the care, but they do the little things. They might
Yeah.
help with them. They might even help with a meal or shopping or help you go into the community. They help with those activities. I wanted all of the advantage of assisted living level of support up to that without any of the baggage. What I'm
Yeah.
saying about the baggage is I want to have that at home. I want to arrange that level of support at where you live, and I want to provide that support in your home and in your neighborhood. And that's why we called it the Neighborhood Network, because what we really did, Evo, is we organized all the care of a neighborhood, a normal neighborhood, a flat out normal neighborhood. We
Yeah.
organized that care using technology and people who deliver the care just like you would do it in assisted living, but better and for a fraction of the cost. So the whole
So,
idea is to go
yeah.
way upstream with seniors like me that aren't needing care, the planners of the world, right? The people who think ahead,
Yeah.
that know they don't have enough money to live in the system, but they don't want that life. So I want to go after and support seniors who are at the edge or going into retirement and they want a long life. They want to live a better life. I want them to engage in the kind of behaviors and the skills and do the things, the simple little daily things that's going to make their life long and happy. I want to take away the risk in their life, and I want to give them the support they need as they age organically. Now, when I use that word organically, I want it to ebb and flow around the needs. I wanted, if I had my parents that had 10% needs unpredictably, whenever those needs happen, I wanted to. You remember the show Bewitched?
Yeah. Yeah.
So you know that
Classic.
she could wiggle her nose and just make something pop in,
Yeah.
right? Well, honest to goodness, that's kind of how this works. The whole idea is that a neighborhood network organizes almost a virtual organized neighborhood approach to care, where care is an amenity of a normal neighborhood. And then it's delivered directly to the person organically, that they self direct on both the platform of technology and human in home support, delivered by professional neighbors and caregiving staff and support, all kinds of support staff that can be on your beck and call and use any way you want, but also a platform of support that will allow you to actually have your family help you before you actually ask somebody to help you that needs care if you want to. If you had a son that would be happy to do some things if they're able to, and you wanted them to be call first, then that's what would happen. And there would be no cost for that, because there is no cost for that. But then if that isn't available and you still need support for 15 or 20 or 30 minutes or an hour, it doesn't really matter. You could get that support simply by asking for it. And it could be there within 5 to 15 minutes of need, 24/7. That's the way, basically being able to deliver support as if it's a facility, but it's just a virtual facility in a normal neighborhood where care is organized and delivered by a core group of dedicated, professionally trained and funded professional neighbors and mobile staff that can be on and delivered to home anytime a need is self-directed. And you add to that 24/7, what I call an I coach or a life coach, a remote support, that's your remote support, that is just a button away. And if I could, I kind of want to segue into the technology because most seniors, especially older ones, are a little bit afraid of technology. I know how complicated it can be, right? Well, the neighborhood network is a combination of remote support technology that's delivered by what's called iLink technology. It's our platform of care, combined with professional neighbors that live in the neighborhood that deliver care, combined with mobile staff that are in the neighborhood, ever present to deliver care, all full time, delivering care. And the technology is there for the people to have control and able to self-direct help. So we want to put all this in the seniors' control. They may not know, I always use the word OnStar. I know it's a trademark name and stuff, but it gets the point across. We all have OnStar. Everybody has OnStar and never uses it, right? But it's there.
Yeah.
And if you ever had an accident, the accelerometer would automatically turn that on and then ask if you need help, right? We are been socialized and willing to pay a small amount of money to have that always available because of what's possible, right?
Mm,
I want to make sure that you understand that the technology we have can be every bit like that or one that you really engage in and need every day and every moment. But it could be one that's just there so that you have it. But then and it can be there to kind of encourage periodically the use of these preventative practices, even track them to help you track them if you want help to track them, to make sure you do the little things that you're supposed to do to extend your life and keep it completely independent. But once you have needs, the technology is there to connect you with the resources, whether it's your son or daughter or family member or friend or a neighbor that or it's care professionals by Good Life. There's professional neighbors or deployed staff that do. And if you use those care professionals, whoever they are, you only pay for that amount of support that you actually get and use, which is so unlike other care models where basically you have to pay for it whether you use it or not. We want a system where you can sell. You're in control. You decide it. So that's kind of how it works as a whole.
mhm.
Um, but I just to show you how simple things are.
Yeah.
The technology it's sophisticated. It's a
Yes.
platform of support. In the background, there's a lot of time, energy, and investments in R&D that went into these products. However, from the front end, the senior, we have a mantra, Good Life and iLink, that everything that we do should be one finger and one button. That's it. There is no heavy lifting on behalf of our customers. All that heavy lifting is behind the scenes. So, for example, I'm going to just show you that this is an intercom. See that
Hmm.
red button?
Yeah.
All you got to do is press it. That's it.
Just one button.
It's like in that sense, it's like on. So you press it, and that's a amazing 9-array mic, full duplex intercom that goes directly to your iCoach, and they are there to help you. And you say, "Hey, I'm hoping that you could ask my son to come over to help change a light bulb." It could be that simple. Or I need
Mm,
somebody to come help change the light, because that's a risk factor that you don't want to get into. As a senior, is one of those things that you do,
yeah.
and you hope, instead of getting that little bit of help from somebody that could do that. Or it
So
could
I
be, I'm not feeling so good and I need some help, or could somebody come over and help me
well, I
on
have a question. Is the iCoach 9 to 5? When is he available? When is the iCoach available?
iCoaches are 24/7. You can do it 2 in the morning or whatever, and it's just as friendly. It's just as personal. It's your concierge almost. And it could be something like, it could be something important, or it could be used so that you need some milk. You need
Mm.
somebody to help you go shopping. It could be that simple. So
24/7? There's someone
24/7,
available?
anytime, 24/7. Just
Weekends?
like yeah, of course. We're
Wow.
talking about just like an assisted living would never close down.
Wow.
Our
Yeah.
system never closed down. So that neighborhood that we support, care is an amenity of that neighborhood that you can control. And then you would have another very popular product. This is an Amazon Alexa show.
Yeah. Yeah.
Everybody has one now. You probably have one.
Yeah, I
I
have one.
have
Yeah.
I have 3 or 4 of them. They're connected to a lot of things, but the problem is they're complicated.
Mm,
So ours has been adapted for seniors to make it really, really simple. You can say, "Call help," or call Mary," or whatever you wanna do, and we can have a little list of the commands that you can sit there and use that's right there for you. But just it's simple commands that you can use. You can use it to check the weather, you can do that. But also, if you wanna engage in some of the healthy practices that we want you to do, we can have a coach send you information periodically and reminders through the day. It could be medication reminders. It could be reminders or that there's human people,
Mhm.
humans reminding you about, things that you need to do. About drinking water if that's something, and making sure that you engage in some of the practices, or if you have schedules, making sure you're reminded of some of the schedule. It's kind of your virtual helper, uh, if you will. But from our perspective, it can be just an Amazon Alexa and an intercom that's in your home. That's all you see, but it's connected to a platform of technology. You can also have a variety of sensors that would let you know if, let's, for example, if you got up at night and you walked to the bathroom, but you didn't go back to your bedroom in a timely fashion, and you wanted somebody to like check in on you if it was over an hour in the bathroom or over 30 minutes. I mean, there's a point in time where it'd be a concern to somebody, right?
Yeah.
Well, that allows all kinds of customizable alerts that come to your coach, virtual coach, to say, check on you, say, hey, are you doing okay? Just over
Mhm.
your intercom, or through, even your phone. And the other thing I don't even have to show, but it's a simple phone app. And the simple phone app is just a button on your home screen that is always available on your home screen that
Yes.
you can press, and makes a call to we use it, it's called it a calling tree. It can call whoever you want, but if they don't answer, it will arise and escalate to your iCoach that's always there. So it can first go, just like the intercom, it can first go to your son, but if he doesn't
Mhm.
pick it up, it goes straight up to the iCoach so they can help you. So there's never a time 24/7 that somebody isn't going to answer that to help you. So if it's the phone app, you could be playing golf and you're not feeling quite right. You press it, it goes to your son. He doesn't pick it up. It goes to the iCoach. Your iCoach picks it up and say, what's going on, Fred? So, well, I'm not feeling really good. Can somebody come get me? Sure. And it geolocates them so we know where it is. We can go pick them up and bring them either home or take them to medical services, or dispatch 911. Whatever we feel is the best thing that we have to do to make sure that you're cared for would be what we or you would do. But it's a friendly, personal way that you can get help in and out of your home for, I'm
Mm.
saying, like, dollars, not thousands. I mean, this system, that basic system that we're talking about, is under $300 a month. Now,
Wow. Yeah.
that's for the system and for the availability, for the use, for your virtual coach 24/7, and for the time of the virtual coach helping you, and for
Mhm.
the reminders and all the stuff. And there's more to even talk about than that. It doesn't pay for the time of staff duty for it, because that's more costly, but
Yeah.
you only pay for the amount of time that you actually use them, which is unheard of. And see, without this technology, that's the problem with in-home care. Since you have to plan that in-home care in advance and you deliver it on the schedules, you have to pay for blocks of time, whether you need it or not. And so it's really expensive. This goes from as little as, less than 300 a month to very increments of small amounts. It could be, I need help to go shopping. I want to go
Yeah.
shopping, or I want somebody to go shopping for me. And here's my list. Or I need somebody to do some cleaning in my home, or I need some home repair, and we need to figure out somebody to do that. That's kind of like the concierge work that we do. Or it could be, I need somebody to help me in care. It could be any of those combinations of stuff. Or I want my son to come over, or I want this. I mean, you are controlling this stuff. One other
Yeah.
thing, and I'll kind of stop with this part of it, but another part of seniors having is for seniors to have purpose. Just because you retire doesn't mean that you don't want to contribute, and just because you might need help doesn't mean you can't give it. So we really use a pay it forward system, a volunteer system for people who want to help other seniors. So, like a young senior like myself can help volunteer to support aging seniors when I can. And I could do it as my free service to do a kind of a pay it forward system.
Hmm.
So we incorporate volunteers within the neighborhood to help other neighbors in need or churches to help. So this is kind of one of those systems where you use natural supports, free supports, and then you use paid supports when they're needed. And virtually, we can bolt on into your home a nurse to talk to you or a
Mm.
care coordinator to talk to you to give you, ideas on where you can get care or somebody to help schedule that for you. We have those resources in the background to help you, but you control them and you control the costs and you only pay for what you use, if that makes sense.
Oh,
So if you're a young senior, you don't really use anything other than, you get engaged with the system and stuff. We also have this wonderful social network partnership we developed. It's called Navigating Life. It's
mm.
a great private social network where it basically connects you to other seniors and other people in your neighborhood if you want to, so that you can get into hobbies and activities. And we can use that to encourage, different kinds of interactive activities for people and friendships to emerge. And so you can post things to it like you do. It's exactly like Facebook, but it's a closed
Oh.
system. It's completely HIPAA proof. And it basically allows people who are in the neighborhood to work with each other and to talk with each other and to post things and to get ideas from those sorts of things. It's really a cool system that really gives some support to people if they want it. And again, you hear me saying that if you want it a lot, but the whole idea of the system is to give you this shelf of supports that you want and that's available for when you need it, and you will, and it averts more costly care that you'll have to pay for if you don't do this.
So it gives you control over this, what sounds like a very complicated service that kind of aggregates multiple resources into one platform. Um, I have so many questions. This is unbelievable. I've worked with Good Life and I didn't know a lot of those things about Neighborhood Network. So conceptually, it is clear that this it's crystal clear how valuable this is. Is it functional right now?
Yeah,
Have we
we've been
beta
using it
tested
since
it?
2010. It wasn't beta. We use this multiple places. It's won national awards, most innovative service model awards. It's won other awards nationally. The reality is, it's a combination of advanced technology that's simple to use in the home, like I just showed you, combined with a neighborhood support system, really emphasizing the ability of seniors to self-direct the care they want, putting them in control and letting them control their care in a very self-directed way and letting them only pay for what they need. And by the way, we even have a ability that if you don't want to use Good Life folks and you want to use your natural family and you maybe even want to have want to pay the natural family or you want to pay a friend to do it, we even do payroll services for people that they just have to tell us how many hours they've done it, and we'll help with the coordination of all of that. So we literally provide you a ecosystem of support for a neighborhood. Now, the truth is we're targeting our neighborhoods one neighborhood at a time, and we're looking at this, and we can provide the many of these supports anywhere. But if you really want that deployed support from Good Life, there's certain areas, but they're just normal neighborhoods and they're big areas. So we have great aspirations. This is not only something that Good Lifers do, but we're promoting this for other providers to do.
Yeah.
This is a new way to deliver care. We are literally trying to change the world for the benefit of seniors. And we want seniors to know that you got to put as much energy in preventing the need to go into assisted living that you do financially to prepare for retirement. But they're just simple things you have to do and simple things you have to not do. And you need help to make sure you do those and not do those. And we need to, coach that along. And it's worth, less than $300 a month to do that.
Oh
Because
my
if you
goodness.
don't do that, I mean, look, that's what you pay for. I always laugh about this. Even when you were younger, when I was younger, I paid for I paid for a personal trainer. I paid $125 a week for a personal trainer just to make me look better and feel better, right? Why wouldn't we want a personal coach to help at the very same thing and to save literally, you know, tens of thousands of dollars, $10,000 a month? I mean, do we really want to give up all of our financial resources and our way of life just because we won't do a few things earlier in life to avoid that?
Of course, two of these a day are $300 a month.
Yeah.
Two cappuccinos.
Craziness. It's craziness. And what son or what adult daughter wouldn't spend $300 a month for a family member? Because here's the truth of the matter is when a lot of the seniors that they have enough money to live independently, but they don't have enough money for senior care. They just don't. When
Yeah,
they need that, I'm telling you, 9 times out of 10, that falls off on the next generation. It's the
yeah,
sons and the daughters that end up having to pay for this stuff, and they do it because they're in love with their family and their
of
family's
course.
cared for them. But at the end
Yeah,
of the day, that's not fair, either. I mean, I would, as if I had an aging family still with me, I would willingly pay $300 a month to make sure they had all the supports that they needed in case they ever need it. I will tell you,
of
there's
course.
some simple practices you have to do, but again, there's one important practice, and that is you have to have a safety net for things that you have to have. And if you don't have a safety net, what happens is you end up doing it yourself and accepting that risk, and that risk is inevitably going to cost you money and your life.
Yeah. I have a question about the eye coaches. Are they like a OnStar dispatcher or do they actually know the resident?
Oh, the professional neighbors who are delivering support often are also the people who coach. So they're people that you know.
Okay.
And
That,
then when those professional neighbors that help deliver support in their neighborhood, either in person or remote, if they're not available, it goes up to a centralized eye coach that works on a caseload, and they know you too. So
oh,
it's the reality is always somebody that it's always somebody that's engaged, and we don't want this technology to sit on a shelf. We want you to be comfortable using it. The reality is you have to practice. You have to practice using the system not because it's complicated, because we want you comfortable. I don't know if you ever heard of a PERS, but it's those things that you wear around your thing that you press
oh
and
yeah,
if
I've
you
seen
do it,
those. Yeah.
it goes to a call center and then they usually dispatch 911 and all heck breaks out. It's like
The
they don't
ambulance, the
know you.
fire
So the
car.
only thing, yeah, they don't know you. So the only thing they can do is dispatch 911, and that
Yeah.
covers their liability because that's all they know how to do. But, seniors will never press that button because they know what's gonna happen. They know as soon as they press that button, there's gonna be police and fire people and EMS people at their house. They're gonna be taken to the hospital. There's nobody to take care of their dog. It's all these little practical things they go through. When you hit the button here, you get a friendly face. There's professional neighbors that's en route to help
Oh,
you, and you may need 911, but there's still somebody there to take care of your affairs and to make sure that you got everything you need. And if you want them, they'll go with you to the hospital to make sure there's a pass off to your son or whatever you need to make sure that it's going to work great for you. Again, you decide all of that.
I see. I have a question. You mentioned Netflix, but there's also Amazon Video, there's Hulu, there's Paramount Plus, there's Peacock. So, are there many other providers of this type of service? And if there are, why should people choose Good Life?
Well, I mean, because we started this whole enterprise, there's people that's looked at this and they've tried to do a little version of sort of organized care on the cul-de-sac or something like that, or in an apartment complex or whatever. This is a different approach, but I think it will be a common approach. So I feel very strongly we have technology, we have a service model. I'm happy if other people do it, but we're the guys that created what we're doing here. We're driven. We're a not for Good Life is a 501c3, a large not for profit company that with a mission to help people, have a meaningful life. And by the way, we also want to support the people who make that life possible. So we have a dual mission of supporting people who need help to live more independently while also supporting the people who make that possible, because we believe unless you improve the lives of the people that are the deliverers of support, you're never going to have reliable in-home help. And this is why we have now professional neighbors as opposed to just caregivers. The stability of professional neighbors is incredibly greater than just simply shift staff. They live in the neighborhood. They're paid well. We actually pay for their housing costs. It's a really well sought after position, and it's it's kind of a combination of being able to work from home and be dispatched from home in your neighborhood. You have such relationships that you develop. It's a really cool job, and people stay a long time. I think around average of 7 years in that job. So it's a great job that's broke through all the instability barriers of care. Now we also have mobile caregivers, but they all work full-time, work shifts. They actually work 3-day work weeks, which is really shown to be the best way and approach for delivering, care. So we try to do all of that. But again, we also use your son and your daughter and anybody else that you want to throw into the mix. And if you want to hire some people for us to use first, we would do that and do your payroll if you want.
Wow, that was uh, quite possibly the most informative episode we've ever had of the podcast. It's a lot of information to process. It's very valuable, I think. And I guess the last question I have is, what can people do? Can they just Google us, give us a call, and
Yeah.
start planning? Is that possible right now?
We're going to throw a QR code. We're going to get a contact number here right at the end, and you just call it. And, we're going to also show some of the supported neighborhoods in that. So when you call, we'll share all that information with you. And we just want you to engage. And even if you don't live in a supported neighborhood, we can still do all the preventative care and all of the support. We can connect your family to you. We can do so many things, even if you're not in a supported neighborhood, and for a very little amount of money. But it is amazing. And I do want to kind of end by telling you, there's other episodes, as you know, in the quest for the good life, and love it if people start listening to them. But one of the things that was the inspiration for this, as you know, Evo, was my infatuation with blue zones.
Yes.
There's just a few blue zones across the world. How many other Evos are 5 blue zones?
There's 5, yes.
5 blue zones. It's these places where people live significantly longer and good lives. And I love to research and look at, like, what do they do? What kind of practices do? What's different about those sort of Norman Rockwellian communities that make people live longer and happier lives? And can I replicate that? And so that's kind of was the inspiration of a neighborhood network, as you know.
Yeah.
And we're making it possible, and we need pioneering seniors that are committed to this and want to do that too. And we need, there are adult children that need to give them a little nudge, because they should give them a little nudge if they need a nudge to make this happen. Let's go.
So if you're interested in your own personal blue zone, give us a call, 913-225-8900, or find us online at mygoodlife.org and contact us. This was The Quest for the Good Life with Dr. Mike Strauss. As usual, we will return back in 2 weeks.